Thank you for the organizers. Thank you, Congressman, for having me here today. Yes, the Philippines is in my heart. I've been going to the Philippines for the last 20 years, since the late Bella Tan introduced me to the Philippines, and I am very annoyed that I have not been able to go to the Philippines for over a year. Today is my day 389 of continuous non-stop work in my COVID unit. I'm here to answer any questions that you guys may have regarding my experience. A couple of things. Number one, I am not affiliated or associated to any pharmaceutical industry of the medications that I'm going to talk about. I don't get any royalties. I don't get any money. So what I'm going to tell you is the truth and nothing but the truth based on my clinical experience. I don't get any kickbacks. I don't get any kind of stuff like that. And I want to be very transparent. What I'm going to tell you may go against some people that don't agree with it, but it is my experience. And, you know, I've been in medicine since the year 1980. That's when I started my medical school. And I have seen a lot of stuff over these last 41 years. But this last year has been by far the worst.
Dr. Varon, have you ever caught COVID yourself in 389 days?
I don't know. And I'm being very honest, you know, there were a couple of instances through 389 days where I actually felt very sick, where I have fevers, where I had chills. But unfortunately, you know, somebody had to take care of patients. And I did not have a chance to rest. And guess what I did? I took Ivermectin. Within 3 days, I was fine. I didn't test myself. And I know that saying this in front of everybody is kind of bad. I think I did. I am fully vaccinated, which is good. But I still keep all my precautions. But you are correct. I mean, when you go to a COVID unit, 389 continuous days, you go in, it doesn't matter how much protection you get. I mean, sooner or later, you are going to get infected. But at the time, I took 15 milligrams because I'm kind of a heavy guy, 15 milligrams a day for 5 days for treatment. And that did the trick for me.
In relation to your fight against COVID, do you think ivermectin is very critical in preventing and in helping those who are in the hospitals to recover, Dr. Varon?
That's a great question. So that actually brings me down to talk about the Flccc, the Frontline COVID Critical Care Alliance. In March of last year, when all hell was breaking loose, you know, we were trying to do things. We didn't know what worked, what didn't work. So at that point in time, 5 of us from the United States decided to create a small group of, I'm going to call it clinicians that were caring for patients, but were also people that are very well educated in the medical field. Dr. Paul Marik, Dr. Pierre Corey, Dr. Jose Iglesias, and Dr. Humberto Meduri. We would have these Zoom meetings at 2 o'clock in the morning, 3 o'clock in the morning, looking at ways to fix COVID. COVID kills you by 2 mechanisms. Mechanism number 1, inflammation, a lot of inflammation. That, you know, when your lungs get inflamed, you don't breathe, you die. But not only in your lungs, you get inflammation everywhere. Second way by which it kills you is excessive clotting. So when we realized this, we said, wow, we need to come up with a way by which, instead of fighting the virus like some of the other medications do, you know, the remdesivir and stuff like that, we need to go on and treat the active issues, inflammation and coagulation. So we created at that point our first protocol, which is called the MATH Plus protocol. And the MATH Plus protocol includes M-methylprednisolone, which is a steroid or cortisone-like agent, A, ascorbic acid, which you guys know as vitamin C, T, which is thiamine, which is another vitamin, and H, which is heparin. As we did this, we started to add more things into the mix. And, you know, we were criticized. We were crucified. People said, you guys are crazy. You guys are going to give cortisone to somebody that's having an active infection, they're going to get worse. And surprise, surprise, people started to get better. At the same time, we started to use ivermectin in the hospital patients. And our results were amazing, but we didn't know why. So people started to use then ivermectin in the outpatient setting. And we created what is now known as the eye mask protocol. And again, all these protocols, all the medical rationale behind it, you can find it on our website at flccc.net. The reason why we did this is because people were dying. Ivermectin, we saw that it was being used in some countries where they have a lot of parasitic illnesses, and those countries have a lower number of cases of COVID. And that's when we said, oh, let's give it a try. And yes, this has been a lot of a trial and error kind of thing, but it has worked. Whether or not ivermectin is key on the treatment of patients, the answer is yes, but not just on the treatment, also on the prevention, on the prophylaxis of patients. Since then, we have endured in an uphill battle in the United States and around the world with institutions such as the Centers for Disease Control and Prevention in the US, the Food and Drug Administration, the World Health Organization. And it is amazing that people don't understand. Ivermectin has been around for 4 decades. It is the winner of a Nobel Prize as a medication. Ivermectin has been used 3.7 billion times in the world. Billion, not a million, billion times in the world. Ivermectin is considered one of the top 10 medications of the World Health Organization when there are catastrophes. It is an anti-parasite drug. Yes, it's for parasites initially, but we have come to understand that ivermectin has amazing antiviral and anti-inflammatory properties. And not only that, we are now using it even for patients that have the post-COVID syndrome. 50% of people that have symptomatic COVID, they will end up having all these aches, pains, headaches, things like that in the long run. And we've been using it and it works. Why hasn't the WHO or the CDC or anybody else say, hey, go ahead and use it? And I don't have any answer for that because the data is amazing. We have data from Bangladesh, India, Egypt, Argentina, Mexico, Peru, it is incredible where you start a massive campaign of giving ivermectin and the number of cases of COVID just plummet. It is unreal. And yet these big institutions, they say ivermectin should only be used in the context of a clinical trial. That's what they say. They do allow us, at least in the US, to use it off-label. Well, again, I would use their own data against themselves. If it was such a bad agent, why is it on the top 10 list of the World Health Organization emergency medications? That would be number one. Number two, 3.7 billion doses, not one case reported of neurological abnormalities, not one. There is really there is only one contraindication for the use of ivermectin, and that is for people that have kidney transplants, that they take another medication to kind of help them with their immune system. And the levels of that medication may shift to some extent when you take ivermectin. So in those patients, you can give them ivermectin, just make sure that you check the levels of that other medication. But there are no contraindications. We're giving it to a lot of people, and it works. It works, but Unfortunately, this is where all the drama begins. And I don't know how you guys do things in the Philippines, but I'll tell you, in the US, everything ends up being money. And this is where you have companies that are sponsoring medications that cost thousands of dollars to treat a patient with COVID, which actually don't even work, but like the remdesivirs and things like that, versus a $3 medication. That's where you start having that. It's a political situation, and I'm sure that Congressman, you know more about politics than I do, but we see that here in the States. So what I'm doing is basically fighting a political fight. I'm not talking about science. I'm talking about a political fight.